Okay, well, good morning. I have 7:30, so we will go ahead and get started. It is indeed a pleasure for me to be able to welcome and introduce Dr. Michael Hart. So for those that don't know Dr. Hart is currently a professor of pediatrics at the Virginia Tech School of Medicine, and he was a past section chief director of pediatric GI and nutrition here at Carilion Clinic. Mike, educational background, he earned his bachelor's degree in nutrition at the University of California in Davis, and his master's degree in nutritional biochemistry at the University of Nebraska, where he subsequently obtained his MD. Mike then went on to residency at UCLA and did his PGI Nutrition Fellowship at the University of Nebraska. He then joined the medical faculty at the University of Nebraska at Creighton University, and then at Emory University, and I believe he was a section chief there for GI nutrition at Emory before coming to Virginia. Mike fell out of the sky one day for me, and I've rejoiced that day ever since. So Mike is the past president of the AAP Executive Board for the section for GI and nutrition. He's a past editor of the AAP Grand Rounds monthly newsletter, the past chairman of the Clinical Practice Committee for the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition. What Mike's bio does not say is that Mike has more energy than one person should ever have. Mike would always see one more patient. And Mike was a one-man marketing person division for Brilliant Children's. Mike is an amazing human. I will forever respect him. And I just want to say thank you for all you did for Brilliant Children's and for the children of Southwest Virginia. And Mike, it is a pleasure to have you back today. So welcome.
Well, thank you very much, Don. Thank you. It's great to be with all of you. Thank you very much for asking me to participate, and I really appreciate it. Congratulations to all the residents that are finishing up the third year, also the second year and first year moving up a notch. And I know we'll be inviting or welcoming some new residents very shortly. The reason or the program I'm going to talk about today is really a timely program, because I think many times we all fall into a habit of kind of indifference where it comes to infant formulas. And I wanted to share with everybody today some of the innovations that have occurred in infant formula development over the last 20 years or so. In terms of disclosure, I am on the Speakers Bureau for Mead Johnson Nutrition, but I am not going to be discussing any brand names of formula during this presentation. This is going to be a straight science-based presentation. Specifically, what we're going to talk about is to discuss the impact of nutrition on growth and development in the first 1,000 days. And that really means from conception through the second year of life. And that was really, I think, the reason I was drawn to pediatrics was this. Not only is my background in nutrition, but the reality was this is a big deal. We all know in pediatrics how important infant nutrition is, and maternal nutrition during pregnancy, during lactation, and during that early childhood, because it makes a huge difference in that child's ultimate development and what they are going to achieve in their lifetime. Secondly, we're going to talk about the effects of prebiotics and human milk oligosaccharides and their role in gut infant health and gut development. This is a big deal also. We're all hearing this prebiotics, probiotics kind of thing, and I think it gets a little bit confusing. I wanted to share some of the science with you. Thirdly, but not least, we're certainly going to explore the importance and the role of docosahexaenoic acid and arachidonic acid, both essential fatty acids for us as humans during that neonatal period and beyond, specifically with a focus on brain and cognition, as well as eye development. And last but not least, we are going to describe the unique characteristics of a relatively new product that has been added to many infant formulas, not all yet. Hopefully it will be a standard where all infant formulas will have this, and this is called milk fat globule membrane. I'll talk about what it is and show you some of the data on how this impacts our development. It really is an exciting time, and I really want to share that with everyone. So in terms of the innovations that we see with optimizing infant nutrition, we recognize that basically the long-chain polyunsaturated fatty acids play a key role in terms of improving brain and eye development. I'll show you some of the data for that. we now are all have kind of understood. These have been in infant formula since 2001. So for the last 20 plus years, all the formula companies have now added long chain polyunsaturated fatty acids, docosahexaenoic acid, arachidonic acid that we must consume in our diet. We cannot synthesize these ourselves. Prebiotics have been added in the last few years. We'll talk about those specifically. The PDX is polydextrose, the GOS is galactose oligosaccharide, and the human milk oligosaccharides, 2-fucosyl-lactose is the one specifically I'm going to show you some data on. And certainly last but not least, the milk fat globule membrane. This is a huge deal. Major step forward in infant formulas. You may not be familiar with this. Hopefully by the end of this talk, you'll be familiar with what milk fat globule membrane is, why it should be, I think, in virtually all infant formulas, and how it actually translates into improvements in health. So let's talk about some of the optimal nutrition factors. We all know this. This is coming from a pediatrician's heart, if you will. We know that nutrition and stimulation are important components for brain development. You need one and the other. Infants need clearly a nourishing diet, goes without saying, but we basically also recognize the importance of stimulation. We know that nutritional deficiencies do impair brain development. So this, to really meet our maximal achievement, we must have that combination of good nutrition and important to have infant stimulation as well. As I mentioned, the first 1,000 days is critically important for nutrition window in terms of its impact on that infant's development, the toddler's development, the fetal development. We know how important it is during you could see the first and the second trimester, third trimester, and then going on beyond up to the second year of life, the critical development events that occur that you cannot make up later. If you have a child that is malnourished, or mother that is malnourished during this time, unfortunately, you can't go back. We know that the brain has remarkable plasticity, but where it comes to synaptogenesis and refinement during early development in terms of the brain synapses, the function, gray matter, white matter development, it's one of those that leaves you permanently damaged if you can't make it up, if you will. So we know that the formation of these important primary structures and processes occur. We know the myelinization is critically important, and that's where the milk fat globule membrane in particular comes into play with the addition of sphingomyelin, with the addition of these complex lipids that we'll see, these kind of these carbohydrate lipid moieties and carbohydrate protein lipid moieties. The sensory systems, the hippocampus, of course, prefrontal cortex, brain circuits, and of course the monoamine transmitters, neurotransmitters. These all occur during the first 1,000 days and cannot be made up, if you will. In terms of the linear growth, and this is kind of a fascinating study that was done. If you look at the details of the study, this was a Brazilian study, and they did a lot of kind of analysis of data over decades, literally. And they actually came out with looking at linear growth as a surrogate marker of nutritional status, and followed those children in infancy and then throughout their lifetime, over 30 years of age. This has been done with breastfeeding. We've known that some of the European studies that have looked at breastfeeding, looking at duration of breastfeeding, have shown similar data. And that is basically that the linear growth in the first 1,000 days actually translates into beneficial effects down the road at 30 years of age. In this particular study, looking at adult IQ, where you see improvements in IQ based upon the correlation with linear growth, years of schooling, and actual income, financial income. So this was and we know that this data occurs in breastfeeding as well. The IQ status at age 19 and 27 in Scandinavian studies have shown us that actually translates into improvements, even when you normalize for maternal education, for income, for smoking status, et cetera, et cetera. So it's clear that we are seeing beneficial effects in terms of the nutritional status. We also know, of course, that key nutrients are critically important for brain and immune development during these prenatal and neonatal periods. We've all studied these ad nauseum, but they are critically important. We're beginning to understand more and more and more the role of good maternal nutrition and what happens when you see some of these deficits. We recognize now, for example, and I think it becomes almost reflexive. We've talked about folic acid as a good example, and the deficits that we see in both male and female parents how that even if you're thinking about getting pregnant, you should be on a folic acid supplement. The association of neural tube defects and the improvement that we see is dramatic. Well, we're also translating that into many of these other nutrients that you see on the screen there. Every one of these translates into critical developmental factors that play a key role, in terms of the infant achieving full developmental kind of sufficiency, if you will. Now, of course, we do recognize that there's a potential impact of nutrition on the gut-brain axis and the microbiota-gut interplay. We recognize this over the last few decades. We're beginning to understand the critical role that you see this bidirectional, gut-brain axis where it occurs. We see the role of lipids in terms of cognitive function, executive language, executive function, visual acuity. I'm going to show you some of that data. We're talking about vitamins. You see on the right-hand side the critical role on B12 and folic acid, vitamin D in terms of its role. We see the minerals here play a critical role also, not to mention prebiotics and probiotics. All of this plays a key role in the gut-brain axis. Specifically, we were talking about lipids. I think it's really important to recognize and understand that these long-chain polyunsaturated fatty acids are essential to us as humans. We cannot synthesize these, and studies show us that while we require both omega-3 and omega-6 fatty acids, that the linoleic acid and the alpha-linolenic acid are critically important, but interestingly, as you'll see, cannot suffice for the ultimate structural lipids that are actually inserted into our membrane. So that, as you see here in this picture, we see cell membrane phospholipids that have eicosapentaenoic acid, docosahexaenoic acid, and arachidonic acid. And these play critical roles in terms of immune functions. They modulate our immune response. They create and provide synthesis for the eicosanoids and the docosanoids, the resolvins, the thromboxane prostaglandin, the E-series resolvins, and the D-series resolvins. These are all critically important. We're beginning to understand this in medicine, in terms of our general understanding of the initiation and the resolution of inflammation. And I think that there's a lot more for us to understand, and I think that we're getting better and better at this, but this is really an exciting time. So just for that section, just want to remind everyone that the infants and children need both a nourishing diet and a nurturing environment to support healthy brain development. Both are essential. Without either one, you have a bad outcome. A nutrition environment and microbiota composition can influence lifelong health by modifying these inflammatory molecular pathways and the immune response. And last but certainly not least, the nutrition in the first 1,000 days is key in a child's neurodevelopment as well as their immune system development. So let's turn to pregnancy, which is so critical. We know that there are conditionally essential nutrients, macronutrients, micronutrients during pregnancy. We recognize that omega-3 fatty acids, specifically docosahexaenoic acid, eicosapentaenoic acid, are critically important during that pregnancy, but yet the body lacks the ability to actually synthesize these. Not only, and so it must be taken in exogenously in the diet. So that's where it's really key for us to help counsel pregnant women. Our obstetrician colleagues, I think, do a fair job in terms of kind of the prenatal picture. But the one thing that I would have some criticism about is that there's a lot of focus during pregnancy about bad things, infections, group B sepsis, yada yada, all that kind of stuff, and not enough attention paid to some of the key micronutrients and macronutrients that must be consumed exogenally by the mother during her pregnancy. You see, all of these are critically important in terms of development, eye development, brain development, and so forth. We see that the maternal source and the delivery of docosahexaenoic acid is critically important at different stages of development. You see here during the first trimester of pregnancy, the angiogenesis, the immunocompetence, invasive factors, and it decreases the pro-inflammatory. If you try to picture the omega-3 and the omega-6 eicosanoids, docosahexaenoids, the omega-3 tend to be anti-inflammatory, the omega-6 tend to be pro-inflammatory. They're both necessary, but the ratios are critically important, in terms of the omega-3 and omega-6 consumption that we must balance. It's critically important. We recognize one of the things that has actually changed in our culture and our eco-development, if you will, has been that we as humans have increasingly changed our diet, from an omega-3 to omega-6 balance ratio of roughly 1.5, to the average American diet runs that omega 3 to omega 6 in the 0.1 to 0.2 range. So we have really, people have argued that this may be one of the mechanisms by which we have kind of seen pushing of a pro-inflammatory environment or milieu, where you see that all of these diseases that are kind of inflammatory in nature, whether it's reactive airway disease or Crohn's disease or whatever, that this can play a major role in setting the stage for a pro-inflammatory versus an anti-inflammatory setting. Now, in terms of the in utero fatty acid delivery to the fetus, this is really critically important, because you see that the fecal on the left side, the fetal mass of essential fatty acid accrual, it goes up dramatically during the last trimester of pregnancy, as you can see. And the change in the gestation, the umbilical plasma phospholipid DHA levels goes up dramatically. So we can see that a 30-weeker born premature really gets robbed of the actual accrual of the essential fatty acids during that last portion of pregnancy. And more than 90% of the fat deposition occurs in the last 10 weeks of pregnancy. So if you have a 30-weeker born, all the more concern that we must have that child stores are developmentally deficient of the critically important omega-3 fatty acids. And that's important, as I'll show you, because the cortex, the gray matter, and the retina of the eye are so critically important in terms of these essential omega-3 fatty acids that play a role in structure and function. Now, not to make you nauseated so early in the morning, but I wanted to show you a biochemical pathway sort of thing that you probably all have studied at some point in a college or medical school or training. And this basically is why this is such an important issue. This talks about the biosynthesis of docosahexaenoic acid and arachidonic acid. And you can see that we used to think, we all know that technically the essential fatty acid linoleic acid, which is 18 carbons long, omega-6, and the alpha-linolenic acid, which is 18 carbons long, omega-3, we've known that these are essential amino acids for decades. And we basically must consume those in the diet in the form typically of vegetable oils, various vegetable oils. What's happened is interesting. We've also understood in the last 30 years, and I saw the data when it was first being studied. I was actually at various conferences where they were showing primate data. And the key is, and then it evolved into human data. And what happens is, if you look down here, we see that technically we know that it is capable, or that we have the capability of converting that omega-6 18 carbon long linoleic acid into arachidonic acid and to the 2 series prostaglandins, which are considered pro-inflammatory. We also know that our body does have the pathway to convert the 18 carbon long omega-3 ultimately into the EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. But what's interesting is we now understand that this delta-6 desaturase is rate limiting. And both of these fatty acids actually compete for that same enzyme at a cellular level. So the upshot of this is, the take-home message is that if we do take in our diet enough essential fatty acids in the form of the omega-6 and omega-3, that's good. But what we have now found out is that for pregnant women, for example, that we as humans cannot replicate optimal breast milk levels of DHA and ARA by simply consuming the precursor fatty acids, that a pregnant mother must actually consume in her diet actual preformed DHA, typically from fish sources, and ARA to achieve what we would consider to be therapeutic levels. So this had generated many studies. We had this one where they looked at omega-3, omega-6 fatty acids during pregnancy and recognized that it does enhance newborn brain size. If you look at the outcomes and the p-values on the right-hand side, we also recognize that red blood cell DHA levels during pregnancy is associated with gestational length, which is good. This was a study looking at red blood cells, DHA, EPA, the omega-3 index in early pregnancy, and birth outcomes of 108 women. You can see that the results suggested that the gestational age was positively affected by maternal DHA status as soon as early stages of pregnancy. So we sort of are beginning to understand how critically important this is. We recognize that mothers must consume it in their diet. And if you look at some of the studies, this was a study by Brenna looking at worldwide breast milk levels of DHA and ARA concentrations. You can see DHA is in light blue and ARA, arachidonic acid, is in dark blue. And what you can see is, if you look at the bottom, you see that in Japan, for example, Philippines, Chile, China, heavy fish consuming societies, the DHA levels, as expected, are high. And if you look at the rural, environment where there's less consumption of preformed DHA in the form of fish, you see that the ARA to DHA ratios are dramatically different. The generalized worldwide median, if you see here that Brenda pointed out, was at this levels here where you see 0.32 being considered to be the optimal, if you will, or the ideal DHA levels that are present. You see the donor milk levels are quite low, one of the major concerns. So we once again need to be keeping that in the back of our mind when we are prescribing that for infants. So I wanted to see what impact does this have on infant formula, composition related to myelination and cognitive outcomes. So this was a study looking at 3 different formulas, and you see that on what we're measuring here, the ARA, DHA, folic acid, phosphatidylcholine, sphingomyelin, iron, and choline. You can see here that the formulas are basically very similar, and with the exception in this particular case, Formula 2 having more than twice the amount of sphingomyelin present. And you see that the formula composition with the higher levels of DHA and ARA, formulas 2 and 3, and sphingomyelin, Formula 2, showed increased levels of myelin development. This was a fabulous study that really was looking both structurally at actual levels of the actual myelin being developed. And you see that Formula 2 actually had trended to breastfeeding technically, in terms of the levels and the cognitive function. So we've known that breastfeeding is clearly best. It is the gold standard. But one of the things that's really important, as I'll show you, is that not all breast milk is created equal. That mother's diet impacts her levels of breast milk, and that in turn impacts her child's development. So we have a great opportunity not only to support breastfeeding, but to improve the quality of human breast milk by educating moms on their diet. So before we turn to that, I want to just kind of remind you that the key nutrients that moms require during the pregnancy include these omega-3 fatty acids, specifically docosahexaenoic acid, the carotenoids, of course, for vision development, critically important, choline, folate, iodine, iron, and vitamin D. Supplementation with omega-3 and omega-6 fatty acids during pregnancy enhances male newborn brain size as well as gestational age, and multiple factors influence the composition of human milk. The composition of human milk in forms including DHA and AR levels are linked to brain myelinization trajectories and cognitive outcomes. So let's change gears a little bit to talk about stuff that you've really read about a lot recently, prebiotics, probiotics, and HMOs, human milk oligosaccharides. The prebiotics are really, I always kind of grossly think of it this way. If you wanted a healthy lawn, you wouldn't just put grass seed down, you'd put fertilizer down. And probiotics are the grass seed, prebiotics are the fertilizer. And optimally, if you have a nice relationship, then what you have is a picture like this, where you see the prebiotics, in this case, literally supporting the growth of beneficial bacteria. It's been well shown, well understood. I think all the formula manufacturers understand this. And I think that we as humans in medicine are using a lot of prebiotics, or use a lot of probiotics. The prebiotics actually in this situation create an environment to support the beneficial growth of bacteria. It's sort of, they have a very optimal bifidogenic environment. We see the optimal sort of selection for not only the growth of lactobacilli and bifidobacterium, but furthermore, the actual inhibition of the pathogenic bacteria. These prebiotics and probiotics literally will inhibit pathogenic adherence to gut epithelium. They compete for adhesion sites for the pathogens, and they create an inhospitable environment. So we've seen that this is translated into infant formulas actually having the addition of prebiotics, and in some cases probiotics, to the formula where you have a bifidogenic effect. And this is a slide that I want to show you a particular product, in this case having PDX and GOX, which is polydextrose and galactose oligosaccharide. What these do are these are basically not metabolized by us as humans, but when they hit the colon, our bacteria that are in our colon can actually convert these into various butyrate, acetate, products, propionate products that basically create a kind of a more optimal acidic environment that creates and kind of supports the development of bifidogenic bacteria. So what you see here is that this is basically just the slide is showing you that when you add the bifidogenic effect of these prebiotics, you actually shift the microbiota into a more optimal environment, and you reduce some of the pathogenic effects of species like Pseudomonas or Clostridium, for example. This is another study looking at why in this particular product the GOS and PDX are used together. And what we find is that the galactose oligosaccharide tends to be metabolized more in the proximal colon, where the polydextrose is metabolized more in the distal colon. So the combination, sort of like time released or kind of a prebiotic released kind of delayed effect, so that you once again continue to have beneficial effects of these prebiotics in the colonic microenvironment, and thus creates a better microbiota. So I'm sure you've read a lot about these human milk oligosaccharides. These are big. This is a big deal. Human milk oligosaccharides, aside from lactose, are the next most significant oligosaccharide present in human milk. They roughly 5 to 15 grams per liter of oligosaccharides present. There have been over 100 that have been identified. And we also know that the interesting thing is that human milk oligosaccharides literally change during lactation. And it's really fascinating to watch. Breast milk is a dynamic product. We all know it's predominantly whey-based in infancy, and by the time the same mother nursing is 12 months of that infant is 12 months of age, that it becomes flipped. It becomes, instead of an 80-20 whey-based, it becomes an 80-20 casein-based. And this is for developmental reasons that really help in terms of the microbiota of that baby's gut. We know that 50 to 80% of those human milk oligosaccharides are fucosylated, and this is one of those that has prompted many of the formula products on the market now to actually have this particular human milk oligosaccharide added to it. This is 2-fucosylactose. We see it's a soluble glycan. It's already known to be present in human milk. And once again, this is sort of the driving point. Human milk is the gold standard. So the companies that are making these are trying to add these various human milk oligosaccharides to improve the environment that supports not only the gut development, but also the microbiome and the immune system and even the inflammatory response. So we see that basically this is one of those products that is found to be one of the more highly prevalent human milk oligosaccharides is this 2-fucosylactose, and that is in many of the products that are now on the market. So we know that it's important whenever you add a product to infant formula, fortunately it has to be well tested, it has to be safe, and it has to be effective. And I think that's a good yardstick by which to have all of that. This is a study looking at 2-fucosylactose added to infant formula, the impact that it has compared to the control infant. We basically see that it supports growth and development and is well tolerated and safe in healthy term infants. It goes without saying, but it's important nonetheless that these additional products that are added to infant formula do no harm, actually give you benefits. So take home for this section is just that the prebiotics support infant gut health. We're understanding this is really true, not just in infant gut health, this is true in all human development. Recognize the importance of prebiotics and probiotics in promoting the growth of beneficial bacteria, the optimization of the microbiome. We also know that the prebiotics, galactose, oligosaccharide, polydextrose are added to infant formula, have been shown to have a bifidogenic effect and positively create a more optimal microenvironment, which inhibits the growth of a lot of pathogens. And we also know that this human milk 2-fucosylactose supports infant growth and is well tolerated. So I want to change gears back to the essential fatty acids, because this has been really an exciting time, I think, to understand the impact that this has. And this was, like I said, these products have hit the United States infant formula market since 2001. All companies on the market now add supplemental DHA and ARA to their formula, not at the same levels, unfortunately, but they do add them nonetheless. So I think one of the things that I don't think it surprises any of us on this talk or in the room, we know that infant is growing like a weed, basically. If you see this slide on the left-hand side, looking at brain growth, in the last trimester of pregnancy, that infant's brain almost triples in size. It increases 260%. The first year of life, that brain develops another, more than doubles, another 175% growth. in the first year and 18% in the second year, achieving almost 80% of the growth that it will have for the rest of our lives. So we recognize that any damage that is done in that time period of amazing growth is going to have devastating long-term consequences that cannot be made up, unfortunately. Now, on the right-hand side, this is a study looking at the accumulation of docosahexaenoic acid in the brain. And keep in mind that you cannot achieve this without supplementation. So mom must be supplemented during her pregnancy, mom must be supplemented during her lactation, and then the infant must be supplemented. If they're not breastfed, they must be supplemented in their formula and then throughout the rest of life. But what's critically important, if you look at this DHA in the brain, there's two areas that really are optimized, if you will, for the amount of DHA present. And that is the forebrain, the cortex, if you will, the gray matter, and then the retinal cones and the actual retinal development, rods and cones in the retina. 20% of the phospholipids in the brain are DHA containing. 60% of the phospholipids in the retinal cones and rod development are DHA containing. Now keep in mind that this must be accumulated in that baby's brain by the mother during her pregnancy and by the mother during her lactation, but that mom cannot synthesize this herself. She must consume this herself. So this is critically important during this structural lipid. Now, the reality is we know how important this is, but if you talk with most obstetricians or even go on the ACOG website and whatnot, you recognize that there's concerns. All of our parents are concerned about fish consumption and mercury contamination and so forth. And the reality is that there is a lot of mercury contamination in our food chain supply of fish. So if you go to the FDA or the Department of Agriculture or even the EPA, you'll be interested to note that fish are actually categorized in three different categories. Kind of the safe, it's sort of like a green light, yellow light, red light. The green light being salmon and tuna are considered to be optimal sources of DHA with minimal sources of mercury, whereas shark, mackerel, swordfish would be the flip of that. Basically, where the mercury, because those are major predatory fish and they eat other fish and they just accrue and they can't get rid of mercury in their environment. So the reality is, if you look at the websites for ACOG, they basically tell pregnant women don't consume fish more than twice a week. That's not really the optimal story, because the reality is it depends what fish you consume. You know, salmon and tuna are clearly safe, clearly optimal. And the good news is that a lot of the prenatal vitamins that are now on the market are actually using a algal form of DHA that basically where the DHA is synthesized by algae, not from fish, but and fish don't synthesize it themselves. They just eat algae in the wild. So the reality is that if you take the fish out of the equation as the middleman, you can actually go straight to algal sources of DHA. And I highly recommend that. There's a number of studies now where pregnant women achieving 200 to 300 milligrams per day of DHA from algal sources or safe fish sources have translated into actual cognitive improvements in their babies. And I wanted to show you this. Sheila Ennis did a study, and this was really breathtaking, I think, to really point out to us several things. What this study is looking at is all breastfed babies. There's no formula studies being done here. This is really a provocative study, and it basically tells us that what she did is she measured the DHA in mother's breast milk, and then she measured the infant's red blood cell phospholipid DHA levels, and she divided them into groups by thirds, the lowest, basically these triads, if you will. Yeah, and what you see here, now keep in mind, these are all breastfed. There are not any formula-fed babies here. So what she found out is when she looked at visual acuity at 2 months of age and 12 months of age, she found that within breastfeeding cohorts, that there was a difference between visual acuity at 2 months and 12 months if you were in the highest tertile of the mother's DHA or the lowest tertile. So this is really provocative for us. No longer can we be satisfied that we've convinced the mom to nurse. We must also pay attention to the mom's diet, because the DHA levels matter. Even if the mother is breastfeeding, if she's not achieving higher DHA levels, then what happens, her baby may be not getting the full benefit in terms of vision and cognition that comes with the higher DHA levels. So it's very a provocative thing. This basically is looking at This is looking at cognitive performance in this particular case, using the MDI and Bailey developmental scores. This was basically a group of studies looking at the higher DHA levels of 0.36 and the arachidonic acid of 0.72, and looking at cognitive outcome at 18 months of age compared with controls. You can see here that the higher DHA translated into about a 7-point IQ difference, if you want to call that. So that really becomes an important thing, I think, that is important for us to translate this into performance in terms of vision and cognition. Another study John Colombo did out of Kansas, fabulous study, where they basically looked at attention span, the ability of the child to process and to focus on tasks, and found that the kids, this double-blind, placebo-controlled. So basically, when these kids had the higher DHA and ARA levels, they actually were translated in having longer attention span through 9 months of age. So this too is a very exciting thing, that basically these are structural and these are functional lipids that are really high in the gray matter and really even higher in the retina of the eye. And this, speaking of the retina of the eye, various ophthalmologic studies have done where you see basically DHA and ARA supplementation actually translates into improvement on a typical Snellen eye chart by 1.5 lines, where you see, take the child on the left having the DHA area supplementation and the child on the right having no DHA. You could see how obviously this would have impact on a child's development over time. So this really, I think, points out to us the importance of laying the proper groundwork. This also looked at another study that John Colombo did looking at executive function of improvement, and saw basically that there's a linear score improvement from ages 3 to 4, and the control group was lagging behind that. This has been actually documented. He's carried these studies out into the first and second grade now, showing continued improvement in these kids that had the more optimal DHA consumption. So we recognize now that this is important. All formula manufacturers include preformed DHA and ARA levels in their formulas that are on the market now. Unfortunately, they're not all included at the same level, and that's regrettable. Hopefully that will all normalize, but it's certainly, as of 2022, there's still discrepancies in the amount of DHA and ARA added. So we see that basically, in addition to the executive function, we translate that into verbal ability at 5 years of age. So the children assigned to higher DHA groups had significantly better verbal development than the kids who did not receive the DHA or ARA supplementation. And changing gears away from development into allergic manifestations, as I mentioned to you, this whole thing, it's really a fascinating study to look at what's happened to us as a human race in terms of the consumption of omega-3 fatty acids over thousands of years, if you will, the changes in our diet. We're now in 2022, most of us consume what many of us would call a pro-inflammatory diet. In other words, the omega-3, omega-6 ratios are quite dramatically different. This is just one of those studies where you basically looked at the proportion of infants with at first diagnosis of allergic manifestation, where you have babies who are on the DHA and ARA containing versus control infants. You see that the age at first diagnosis of allergic manifestation, which does translate into the atopic march events that occur, is significant. That omega-3 fatty acid and the ratio, not just the total amount of omega-3 fatty acid, but also the ratio of omega-3 to omega-6, does translate into kind of the pro-inflammatory or anti-inflammatory, in this case, the allergic manifestations. So we know that DHA and ARA are important in early life. We know the brain is rapidly growing, like I said, tripling in the last trimester of pregnancy, more than doubling in the first year of life. We know that DHA and ARA in infant formulas are associated with improvements in brain and eye development, higher cognitive scores, enhanced verbal ability in the higher DHA containing groups. We also know that there's a lower incidence of infection and a reduced likelihood of allergic and atopic manifestations. So lastly, let's change to a relatively new product that may be new to some of you on this call, and you may wonder, what is this MFGM you're talking about? What is this milk fat globule membrane? Well, I think it's important to understand how infant formulas were made up until the last couple of decades. Basically, the cow's milk was the basis for virtually all infant formulas in the United States and in the world. And what happened as as it was created, if you will, the fat component, if you will, of the cow's milk was separated, and then the formula manufacturers, knowing the fatty acid composition, chemically how much oleic acid, how much stearic acid, how much linoleic acid in the mother's breast milk, they would add exogenous oils to make the gas chromatograph profile look the same of infant formula as breast milk. That was sort of the logic behind that. In the process, though, what happened is you'd separated off the milk fat cream layer, if you will, and used it for other things. What happened is we now understand that in that cream layer of human milk, all mammalian milk, is what is called milk fat globule membranes. And these are what these look like under a scanning electron microscopy. This is from a rabbit. And what happens is these milk fat globules are created in the mammary gland. And as they are extruded from the cell, obviously they're very lipid polar, so they have to become basically a droplet of oil, almost, if you think of it that way. So you get this resulting package of what is called a milk fat globule membrane. And it's in a lipid trilayer that has a variety of lipids, proteins, as well as carbohydrates. So this is sort of a schematic cartoon of what this actually looks like. And you can see that there are gangliosides involved. And of course, these are critically important in terms of myelinization and synaptic transmission. We see phospholipids, such as phosphatidylcholine, critically important, major constituents of cell membrane, structural lipids here. The sphingolipids, such as sphingomyelin, supporting myelinization of nerves, and a variety of proteins as well, including MUSC1 and lactidherin and so forth. So these all have antimicrobial effects and probiotic effects, if you will, in terms of the developing microbiome. So previously these were discarded, but now with the improvements in food science technology, the milk fat globule membranes have actually there's a technique now in the last 10 years where this can be isolated and actually added back to infant formula, sort of as was intended in the first place. It wasn't intended to remove all of the fat from baby formulas and then add back fatty acids. This was actually a huge step forward. So we see that milk fat globule membrane compounds, they support nerve myelination, synaptic transmission. It's critically important. We know obviously gangliosides and DHA are critically important as well, but the milk fat globule membrane is a massive step forward in the improvement of infant formulas in the last, for as long as they've been having infant formulas being made. This is a major quantum leap, equally as important as the DHA and the ARA story as well. So if we look at lipids from milk fat globule membrane components and their impact on brain development, there have been numbers of studies that have been done. And what we see in this particular study, this is almost 10 years old now, basically where you have a standard formula without milk fat globule membrane. And these are still on the market, by the way. There are a lot of formulas by all the companies that are out there that do not have milk fat globule membranes in them. In fact, more formulas on the market today are void of milk fat globule membranes than actually have them in there. So that's important to understand that they're not all equal. This really sets it apart. While all formulas have varying levels of DHA and ARA, where it comes to milk fat globule membrane, that's not the case. So this was a study where they basically, in blue is the sort of the experimental group that had the supplemental milk fat globule membrane added, and then there was a breastfed cohort group as a comparative. And so they looked at Griffith's mental developmental scale at 24-week change and showed that basically the performance score in the milk fat globule membrane supplemented group was dramatically different. Hand-eye coordination and total scores were dramatically improved. So complex milk lipids improved development, brain development standard in the formula versus standard formula measured by the Griffiths. And this is one of the first studies that showed no significant developmental difference between those infants and breastfed infants. So that we basically were able to see, because human breast milk obviously has milk fat globule membrane, and one of the things that's really important about milk fat globule membrane to recognize is that as mammals, milk fat globule membrane is remarkably conserved across species. So the biochemical structure of milk fat globule membrane from a human to a cow is remarkably similar. There's preservation or conservation of this from a genetic standpoint. So we see that this is really critical, and the homology, if you will, the sequence of these lipids between almost all mammals is remarkably similar across species. So we can actually utilize bovine milk fat globulin membrane. See, these are all bovine supplemented milk fat globulin membrane where we're seeing beneficial effects in the infants, which is really cool. In this particular study, Timby looked at a prospective double-blind randomized controlled trial. This was basically looking at a standard formula versus a formula with milk fat globule membrane added and comparing it against a breastfed, looking at a Bayley-3 developmental score outcome at 12 months of age. In this particular case, you see the control group in red, the MFGM group in blue showed a significant 4-point improvement, statistical power significant. And once again, this basically achieved the level that a breastfed group did as well. So this was one of the first studies looking that the infants who received milk fat globule membrane components added as an ingredient had no difference versus a breastfed control, which is phenomenal. This is really an exciting step forward in cognition of our babies. It's really very exciting. This was a similar study done by Timby looking at immune outcomes in this same group in terms of not cognitive, but immune outcome, where they basically looked at, in this case, a standard formula, an MFGM formula, and a breastfed cohort group. This was looking at infectious disease. We know that this actually impacts the microbiome and it has immune functions within that milk fat globule membrane. So this looked at the incidence of otitis media. And these are all double-blind, placebo-controlled studies in a general pediatric setting and showed that the babies who received standard formula compared to the babies who received the MFGM study had 89% reduction in the incidence of otitis media in this group, similar to that of a breastfed group. So the incidence was remarkably equivalent to the breastfed control group. We know that breastfeeding confers a lot of immune benefits, a lot of infectious disease benefits that we expect, but we've never been able to achieve that with infant formula until recently. And this is one of those reasons the MFGM really plays a key role in terms of the infectious disease profile. Also had less antipyretic use. So we know that the milk fat globule membrane is a remarkable similarity in terms of breast milk versus homology, where we see that the impact that this has in terms of the intestinal immune response, the early establishment of the gut microbiota, and the structural development is all critically important. And the scientists basically theorized, they looked at what happened. Why did these kids have so much less otitis media in the MFGM group and breastfed group than in the control group? And this was a study looking at kind of a DNA RNA fingerprint, if you will. What they did in this particular case is looking at the prevalence of these many oral bacterial species. If you look at the very top there, EF stands for experimental formula, SF stands for standard formula without the MFGM. And you scroll down, way down here, and you see it's magnified to your right-hand side. You look at here, you see that this is from the hypopharynx of the infants on the control group versus the MFGM group, that the control group had more than 4 times the amount of Moraxella catarrhalis in the hypopharynx than did the kids who were breastfed or who had the MFGM in their formula. So that's one of the theories. We all know that this is a culprit in many cases of otitis media. We see that virtually none of the other species were changed, but some of these pathogens didn't take hold, if you will. So that's one of the theories that plays a role. This was a kind of a follow-up study looking to see whether the MFGM components would impact metabolism and gut microbiota. And you see that in this case, breastfed is in red, milk fat globule membrane is in green, and the standard form is in the right. So we basically see that the microbial diversity was improved and was significantly better in breastfed and the MFGM group than in a control formula. Now, this was a fascinating study looking at preschool children, and these are kids 2.5 to 6 years of age. They were given a sort of a chocolate milk type of product that had MFGM components for 4 months, and then they were given looking at outcomes measured in terms of illness, diarrhea, bloody diarrhea, and other infectious things. And the children who received the MFGM on a daily basis had fewer days with fever compared to the standard formula group. They also looked at the diarrhea morbidity in healthy infants. This was, once again, the kids were 6 to 11 months in this particular group, a standard formula, and this was a formula enriched with the MFGM. The endpoint of this study was looking at diarrhea status, and what they ultimately found out that the kids who had the standard formula without MFGM had significantly more episodes of diarrhea and also diarrhea prevalence during the study. So we basically had episodes of bloody diarrhea was less if you had MFGM. The prevalence of total episodes of diarrhea was less if you had MFGM present in the group. So basically the take-home message is that MFGM components, which are not in all infant formulas yet, but hopefully will be. The problem is that the MFGM costs a lot of money to make. So as you might imagine, when you add that much cost in terms of the component, most of the formula companies they typically will provide you with an MFGM containing product or a non-MFGM containing product. Eventually, in a perfect world where you don't have kids breastfed, unfortunately, we ultimately need to get to that point where all infant formulas will have MFGM present. We know that the components have demonstrated benefits in clinical outcomes, otitis media, antipyretic use, not in addition to the brain development. And we also see the impacts in terms of benefits in the gut, including less and significant impact on bloody diarrhea. So take-home message for today, I think, is basically that we know that pregnancy is a critical period during which time maternal nutrition is a key factor influencing short and long-term health status of both the mother and the child. We know that optimal nutrition is critically important during the child's first 1,000 days and essential for supporting critical development in mom's health as well and fueling infant and toddler growth. We know that prebiotics such as galactose, oligosaccharide, polydextrose, and the human milk oligosaccharide 2-fucosyl-lactose contribute to a healthy infant gut, support infant growth and development. We also know that DHA and ARA are critically important in early life throughout pregnancy, throughout lactation, and throughout the rest of our life as well, but critically more so during that first 1,000 days. It actually translates into improvements in brain and eye development, cognitive scores, and improved visual acuity scores as well when added to infant formulas. And last but not least, certainly the milk fat globulin membranes have demonstrated benefits in brain development and immune health when added to infant formula or the diet of young children. So I was asked to give a question. I only have one question here. Which of the following statements are incorrect? Number one, the DHA and ARA must be consumed in the diet as the human body cannot synthesize omega-3 and omega-6 cis double bonds. Secondly, DHA levels in maternal breast milk worldwide vary considerably, are reflective of DHA consumption of the mother during her pregnancy and lactation. Thirdly, the milk fat globulin membranes have remarkable biodiversity and composition across mammalian species. And lastly, milk fat globulin membrane ingestion can modify the intestinal microbiota. And the answer to this is, of course, C. Yeah, and number three, they have remarkable biosimilarity, not biodiversity. So that helps. So with that, I wanted to open it up to questions. It looks like we have a couple minutes for questions. If there's anybody that has one, I can hear all of you here. If you have somebody online and you want to send a note via chat, happy to do that as well. Any questions?
Hey, Mike, this is
Yeah.
Juan Lozagasti. How are you?
Hey, well, good to see you, Juan. Yes, doing great.
Absolutely, same here. Hey, in terms of the maternal, the prenatal vitamins,
Mhm.
that are recommended. It seems that then, aside from the prenatal, in mothers that do not take any particular fish, because not everybody likes fish and not everybody can
Right.
afford fish. Maybe the fish, the omega-3 fatty acid capsules, or do you know of any particular dosing that
Yeah.
is recommended in
I-
that case? I'm talking about prenatal, for
Yeah.
moms.
Right. And I can tell you that, yes, it's a great question. Just to repeat that in case anybody couldn't hear about the, Dr. Lozagasti was asking about the DHA containing prenatal supplements. And there's good news to report. There are numerous products on the market. The one that is, it used to be called Enfamil Lippel. It's called expected Lippel. That's actually the preformed DHA that actually has the 200 milligrams of DHA present. The studies have looked at pregnancy and lactation, found that 200 milligrams per day throughout your pregnancy, think of it just like folic acid, think of it like a multivitamin, think of it like an iron supplement. If I had a daughter pregnant right now, I would ask during her entire, from conception through lactation, she would take 200 milligrams of DHA as a capsule form. The capsule forms are not fish oil. They're actually algal oil. So there's no concerns about mercury contamination that are present now. There's, like I said, there is a product on the market called Enfamil that actually has a prenatal vitamin there that has the DHA with prenatals. The problem is that many of our OBGYN colleagues do not know about these DHA containing supplements, and they're not even aware of what I've just told everybody today. They're not aware of that impact that the DHA supplementation is on the mom. They're more concerned, if you look at the, like I said, ACOG, American College of OBGYN, they're actually more concerned about mercury toxicity in the developing environment than about DHA sufficiency. So the message, if you ask most moms, what do you think about fish consumption? What do you think about omega-3? Many of them will tell you, oh, I don't want my kid to have autism. I don't want them, so I don't eat any fish during my pregnancy. That's a major concern because number one, not all fish are created equal. Salmon and tuna are extremely low in any sort of heavy metal contamination, but yet have very high levels of DHA. So you can achieve sufficiency if you consume 2 servings per week of either salmon or tuna during your pregnancy. But as Juan mentioned, not all women like to eat fish, because it can kind of give them a little bit of heartburn or whatnot. So that's why I personally highly recommend the DHA containing prenatal vitamins. And not all prenatal vitamins are created equal. You go to the drugstore and you'll see that there's a bunch of different brands that are on the market, but you have to specifically look for that DHA containing supplementation. And I would personally take 200 to 300 milligrams per day of DHA throughout pregnancy is considered the optimal dose. More is not better. We just need sufficiency. That's what 200 milligrams per day gives us. Great question, Juan.
Thank you.
It's good to hear your voice too.
Same here. Same here.
I miss all of you guys. It's really great to see you guys.
Hey, Mike, it's Amy Kreider. It's great to
Hey,
hear
Amy.
your voice too.
Thank
I
you.
wish we could catch up. I
Amen.
had a question that I was thinking about was, really in med school and, 20 years ago, we were thinking a lot about the hygiene hypothesis and our immunizations for our increased, atopic disease and
Yes.
autoimmune diseases. Is now the current thinking that it's really more pro-inflammatory diet?
No, true, and unrelated, unfortunately, meaning both factors are at play here. It's as you know, and for many of you on this call, I think, Amy, you get my blog things, don't you? Or do you still get
I
my
do.
blog things? Okay, I still do a blog, and anybody's welcome to sign up. You just have to email me. And I've sent out what we've now understand is that the whole story of the hygiene hypothesis is real and is true, and it's not just hygiene hypothesis for. We know that kids who live in rural environments versus urban environments, we know that the rural environments kids have less atopic manifestation, atopic march, et cetera. If you have a dog in the house, we know that improvement, there's improvement in reduction of asthma and things like that. It seems as though there is a sensitization phenomena that is critically important in terms of this atopic march. In other words, food allergy being a good example. We don't want to restrict a food allergy to the mother or to the baby. We know that early introduction of food allergens translates into less food allergy, not more. Furthermore, but what Amy, what you're talking about is absolutely correct. That inflammatory ratio, that pro-inflammatory, anti-inflammatory diet does set the stage that I think translates into why we're seeing things so different in 2022 in terms of the pro-inflammatory environment. While there's more type 1 diabetes, there's more autoimmunity. We know that this is correlated with the increased atopic march. We see the atopic manifestations. All of that is coming. And I think that one can argue, and there's some very elegant arguments being made, that if you look at our human consumption of diet and the ratio that we've consumed of omega-3 to omega-6 in terms of the pro-inflammatory diet versus anti-inflammatory, the way I picture it is that the pro-inflammatory diet sets the stage, but then also those other factors come into play, such as the sort of the rural versus urban and the food sensitization, all those kinds of things. So I think both of those are at play. Neither one is independent of the other. Great questions. Well, any of you who need, let me go back up there. I wanted to kind of see if I can kind of pop up there. There's my email address right there, if you jot it down. And for those of you that are on the call that are curious, I still do, just enjoy doing this. I still do several times a week a blog that comes as a blind email to people with updates on infant formula, atopic manifestations, pediatric obesity, and things like that. So if it interests you at all, just send me an email at this email address and say, sign me up on your blog, and I'll be happy to do that. Listen, congratulations to all the residents that are leaving us here. Good luck and best of luck to everybody on this. We'll all be in touch. Thank you, guys. Have a good day.